We are joined now by Tod Ibrahim, the Executive Vice President of the American Society of Nephrology. Tod, thanks so much for being here today.
Oh, it's my pleasure. Thanks for having me.
Tod, can you start out by describing the ASN's Alliance for Kidney Health, what exactly the Alliance is, some of the priorities and the goals?
I'd be happy to. So ASN as a membership organization was established in 1966, and initially it was really focused on kidney care in the United States and the now more than 37 million Americans with kidney diseases. And over the last 50 years, the society has expanded to really become a global organization, and there are more than 850 million people worldwide with kidney diseases. And so ultimately we'd like to imagine a world and create a world where there are no kidney diseases. And so that's the overriding vision for the Alliance. The other components, in addition to ASN as the membership society, include a relationship we have with the U.S. Food and Drug Administration called the Kidney Health Initiative, which we established in 2012. The purpose of the Kidney Health Initiative is to eliminate barriers to bringing therapies, drugs, devices, biologics, food products to market that will help people with kidney diseases. In 2016, we developed a relationship with the U.S. Centers for Disease Control and Prevention, and the purpose there was really to eliminate preventable infection in dialysis facilities. And then finally, last year, we were very excited to partner with the Department of Health and Human Services to create something called KidneyX. And KidneyX is the only innovation accelerator in the kidney arena. And again, our hope is to bring new products and really to eliminate the barriers to commercialization for therapies for people, the 850 million people worldwide with kidney diseases.
And I think you've touched on it a little bit, but what are the Alliance for Kidney Health's priorities, not just for the year 2020, but even beyond?
So I would anticipate over the next 10 years we'll be focusing both on core areas that we have a lot of experience with, but also in new areas. So one way to sort of summarize our priorities would be ultimately everything we do has to be how do we improve care for people with kidney diseases. So that's the first piece, is how do we continue to do everything we can to improve patient care. I think the second piece is what can we do to increase, accelerate, really prompt and promote research, discovery, and innovation, bringing these new therapies and ultimately finding a cure for kidney diseases. I think the third area where we need to focus would be around continuing to build on what we do educationally, such as Kidney Week, as well as from an informational perspective. So we publish several journals. We're known as the largest publisher in the kidney arena, and so what can we do to bring all of that content together and really both curate it, make it as excellent as possible, but then get it out into both our members, but also into the broader community. The next goal would be around what I would say is leadership development and culture change. What can we do to help both the current generation of nephrologists and other kidney care professionals thrive in their careers, but also encourage the next generation to become nephrologists? The final 2 points would be around marketing and communications. What can we do in terms of increasing public interest in kidney diseases, but also communicating not just our content, but content from other sources? And again, ultimately we're trying to improve care and cure kidney diseases. And then finally, policy and advocacy, both in the United States and abroad. What can we do to really improve the way the public sector thinks of kidney diseases? What can we do working with different governments to really do what we've accomplished here in the United States with the Executive Order for Advancing American Kidney Health?
That's really become a part of the national spotlight recently. Kidney care, research, education, all of those have been vaulted into the national spotlight. What is ASN doing to help advance kidney care, not only for American patients, but for those around the world?
Well, a good outline would be the executive order. So as you think about the sort of 3 or 4 goals there, one is what can we do to identify kidney disease as early as possible? How can we focus on particularly vulnerable populations like African Americans? And then what can we do once it is identified to slow the progression? So I think that's the first goal, is really intervening early and really focusing on kidney health as opposed to kidney sickness. I think the second piece of it would be what can we do to accelerate innovation? So the way the executive order has framed it, it's moving people with kidney failure currently are mostly treated in-center dialysis facilities. Is there a way that we can move from in-center to home, from home to more portable therapies, from portable perhaps to wearable, from wearable to implantable, and then beyond that, we can't even imagine what potential solutions would look like. And if we do that in the dialysis arena, there are other parts of kidney care. There's a lot of new products coming to market related to diabetic kidney diseases, and there's a lot of research being presented at the meeting. So maybe that's the next area that could really expand quickly. And again, the goal is always what can we do to improve care for people with kidney diseases. The third goal of the executive order, which I think is applicable worldwide, would then be how do we deliver care? What are some in the current situation, what can we do to, again, incentivize caregivers to identify the disease early, but then as we're working with patients, what can we do to slow the progression, to keep people as healthy as possible? Again, the focus on kidney health, not kidney sickness. And then finally, there's a whole other component, which is the fourth goal of the executive order around transplantation. And in the United States in particular, but I think across the world, there's a lot we can do to have more living donors, to help people with kidney transplants, keep those transplants longer and live healthier lives, but also just increase the overall pool of available kidneys for transplantation.
What areas of opportunity do you see in the future for getting some of those things accomplished?
Well, I think a big opportunity is historically the capital markets and the federal governments have not funded kidney diseases at the same rate as cancer, diabetes, cardiovascular disease. So I think that's the first goal, is what can we do to get a public and private commitment to really investing in a space that affects, as I said, 850 million people worldwide. I think the second opportunity is how do we continue to get the best and the brightest to be interested in careers in kidney medicine? And those careers could be as nephrologists, as nephrology nurses, as physician's assistants, pharmacists, but also as technicians, administrators. I mean, let's get people excited about this as a career path because it really is a huge opportunity for people. I think the third opportunity then would be around being creative about how we deliver care. What are some things we can do to be an example to other disease states around innovative ways to care for people? If that's more home-based care, if that's more innovation in terms of the types of therapies. You know, nephrology was the first specialty with what I would say is an artificial organ in terms of dialysis. That's been more than 60 years in existence. The U.S. government has funded it for more than 40 years. What can we do to be the next big sort of idea in medicine? And it seems like it should come from the kidney arena.
Now, on the flip side of things, what do you see as some of the biggest challenges in getting those goals accomplished?
Well, the biggest challenge, I think, for any specialty is money. So what can we do to interest those that control and have funding to get excited about this arena? I think another challenge is what can we do to make sure that there is exposure to kidney diseases at every aspect of training. So even if someone were to not become a nephrologist, but become another specialist like an endocrinologist or to become a primary care physician, what can we do to get them excited interested in nephrology? Because I think that'll more likely lead to better co-management of patients, identifying kidney diseases early, treating them, and then the time when they get referred to the nephrologist. So I think there's a set of issues there that are a challenge as well. And then finally, I think a huge challenge is what can we do to think more globally in terms of, research does not respect borders, it crosses borders, and talent crosses borders. And I think we just need to take a step back and be much more creative in our thinking around what types of relationships we can have at a global level.
What is the ASN doing specifically to try and tackle some of those obstacles?
Well, the two things I'm most excited about would be KidneyX. So really developing a true public-private partnership, focusing on prize competitions, thinking about ways to bring new players in the space, trying to find new funders that are excited about specific aspects of kidney disease, thinking as broadly as possible about the disease. So everything from early stages and perhaps new diagnostic tools all the way through to dialysis, to transplantation, possibly even to end-of-life care. So I think that's one piece that I think will cut across a lot of the barriers that we currently face. I think the other is that the relationship with the FDA, the Kidney Health Initiative, has been extraordinarily helpful and productive in terms of identifying concrete challenges and working together across every member of the community to identify solutions to those problems, to get the best ideas from other specialties, but also to think creatively within our specialty and to try to address them. So I think those are the types of tools we have now that are starting to pay dividends to the community and ultimately to the specialty and most importantly to the patients.
Tod Ibrahim, Executive Vice President of the American Society of Nephrology. Thanks so much for your time today.
Well, thank you.